Welcome to our Monday Spotlight session. If you haven't been on one of these before, this is our opportunity to hear about an innovative volunteer role from an organisation somewhere in the country. And today we're really pleased to be welcoming a special guest from Royal Wolverhampton NHS Trust, who is going to be talking about the clinical volunteer role that's been developed for the past couple of years. So our special guest today is Eleanor Morris. Excuse me. Eleanor is Deputy Head of Patient Experience at Royal Wolverhampton, and she's going to tell us how the role is developing and where it started. So we hope that you'll find this a piece of bite-sized inspiration to start your week. So morning, Eleanor, welcome. Thank you for joining us.
Morning, Sally.
Lovely to see you. And I know that you shared your annual report a couple of weeks ago, and it really stood out, this clinical volunteer role, as something that's innovative and is making a real impact on the pressures being experienced in an acute trust. So I wonder if you could start by telling us a bit about where the idea for the clinical volunteer role came from.
Okay, yeah, certainly. Thanks, Sally. Thanks for that introduction, and thank you for inviting me here today. So just a little bit about me. I'm Deputy Head of Patient Experience at Royal Wolverhampton Trust, so I oversee the volunteer programmes, and I've looked after the volunteers here for, this will be my 15th year. So I'm here today to talk about a volunteer role, as Sally said, that we call the clinical volunteer. I understand that from talking to peers in other trusts nationally during and since COVID, some trusts are introducing volunteers in a phased approach, and not all trusts have been able to place volunteers in clinical areas. I do hope that my talk today will reassure people. We've been doing this successfully since 2020. I'm happy, to talk to anybody if anybody wishes to reach out following today's talk if you need any further information. So the clinical volunteer role came about in early 2020 as part of our response from what was going on at the time with the COVID pandemic, which really was the catalyst for it, because we found that wards and clinical areas really urgently needed help and support. There was a lot going on, as everybody knows, lots of changes. It was all very new, quite scary, and staff. We were short of staff. Staff were being redeployed. Staff were, ill themselves. Staff were shielding. So the call was put out from the trust if we could find any volunteers to step up and support wards. We never really put volunteers at risk, so we didn't put volunteers into areas where COVID was prevalent. It was in kind of our rehabilitation hospital site to start off with. So we were asked for volunteers to provide support with things like bed making, drinks, meal support for patients, just general errands for staff, so a bit of running, fetching, carrying, that kind of thing, stocking up with PPE, however they could be helpful. And due to our volunteer workforce at the time not being able to volunteer, because many of them came into the sort of older age category and were shielding themselves, we sort of asked the question, okay, where do we start? Where do we find these volunteers from? But at the same time, we were being called by members of the community that were hearing about what was going on, and I think people were hearing about the government's call out for volunteer support. So we were being contacted by people who were willing and able to come in and volunteer, and they were people who were predominantly students off school, college, university, people who were furloughed from work. So we devised a very fast-paced recruitment programme, offered training and got these people into support on the wards, which was much appreciated. As things evolved during 2020, the role evolved. So towards the end of 2020, it wasn't so much the focus on the things like the bed making and the meal times and the drinks, as staff clinical staff started to return to work. So the volunteers took a step back and we thought, okay, what else can we do? So the role evolved into things like FaceTime calls with loved ones, answering the ward telephones to update families on what was going on with the patients, because obviously visiting was restricted. We opened up a COVID swab hub, which was kind of our like pre-op assessment clinic. And volunteers acted as runners between this site and the pathology labs. We had a virtual COVID ward in one of our off-hospital site locations, where there was an admin role for volunteers, on-site vaccination hubs. So there was still a COVID theme, but the nature of the roles that the volunteers were doing were changing. We also started to introduce more therapeutic type roles. So, for example, activities with patients, keeping patients busy, occupied, distracted, while they weren't able to have visitors. So we, with the Trust charity, kindly purchased some activities, some board games, and volunteers went into the wards with the board games and the activities and undertook a range of activities with patients.
So it's a responsive role, isn't it, Eleanor?
Yeah.
It's really diverse. So how do you manage the demand for volunteers and their capacity? How do you keep track of what all your volunteers are involved with?
Yeah, okay, that's an interesting question, and it's something we change. Another thing that we change as part of the pandemic, whereas before COVID, we would recruit volunteers and place them in an area and they would stay within that area and they wouldn't really move unless they requested a particular move. But because of changing nature of COVID and we needed to be very responsive, we developed a system whereby we would just liaise with the hospital services and departments very regularly and say, who needs volunteers, what do you need them to do, where, and then we would put these requests out to the volunteers. They're almost recruited as like a pool that can be placed and adapted and is very flexible. They can meet the demand. That's also very helpful for winter pressures, because certain wards really need volunteers more during winter pressures. So what we've seen recently in the winter period just now was our emergency department asked for volunteers and we were placing volunteers in ED. So it has become a much more responsive type role. So some of in the last year, the types of roles and programmes we'll be placing volunteers in, as I've mentioned, COVID swab hub, virtual COVID ward, vaccination hubs, general ward support, patient activity programme, inpatient visiting hub. So when we did reintroduce visiting in March 2022, it was controlled and restricted, so people did need to book patient visits, and we have a hub where this is processed, but volunteers have been on hand here to help, support, guide, direct the visitors as they arrive. Emergency department and same day emergency care, so making drinks, being a guide and a help in the waiting room. Endoscopy waiting room was another role that was asked for, so we've been able to place volunteers there just to keep patients and their loved ones supported, updated, distracted. Well, you know, they could be having a bit of a long wait for things. Requests for volunteers are still coming through from clinical areas and they're becoming more diversified. So as departments in the Trust are hearing about, you know, how useful volunteers can be, they're asking more and more. So we've had some requests recently for new areas where we haven't placed volunteers before. These include the discharge lounge, the pre-op assessment clinic, the surgery wards, maternity. In reception have asked for a volunteer meet and greet, and we're investigating some of their areas at the moment. For example, paediatrics, and the therapy dog has been requested on one of our sites, so we're looking into that as well.
And So there's some really great examples of different departments that have been able to benefit from the clinical volunteer role. So how do you keep staff in touch with what your volunteers are doing and the impact that they're making? How do you raise awareness with the staff?
Okay, so we do a volunteer of the month. We measure the volunteer activity by some software that we've invested in. So we ask all volunteers to log in. They all have an individual account and record their hours and record feedback on a shift as well. So we know how the volunteers are progressing, and if there's, you know, if they're happy or if they're not happy, or is there anything that we need to do to help support them. So we always have an awareness of where the volunteers are, where the shifts are being fulfilled and how many hours they're doing. We produce sort of bi-monthly patient experience reports which go to Trust Board, and we do report on the volunteer activity in those. Also the Trust annual report. I've produced our own volunteer annual report. I wasn't particularly asked to do it, but I just thought, you know, they're just doing such great things. I would really like to get it out there and sell that. So that's been shared with the Trust Board as well. We do a volunteer of the month. So we just pick a volunteer each month that's either done a lot of hours or done something exceptional or something, you know, that's just made us smile, and we present them with a certificate and a letter of thanks, and we put that on social media. We put quite a lot on social media actually, because that's how, I think, just how you get it out there and make people aware. We regularly just put items of interest on the sort of staff or user bulletin, and so that staff in the trust are aware. We ask staff for feedback as well about the volunteers, and we get. So sometimes we just go, our team will go out and about with a phone with a camera on it, and some sort of prepared like speech bubbles, and they will find volunteers, ask them, for example, why they volunteer, and ask them to fill in the speech bubble. Have a nice photograph on the wall. That's always something we can use in reports, but we'll ask staff as well to give us quotes, and then we just collect all the feedback and the sort of case studies for when we need it. Volunteers in week in June is always something that we like, where we really like to showcase the volunteers and what goes on through social media. So we often do a week where each day we focus on a different volunteer and area, and record the volunteer talking, the staff talking about the impact that they've had. And last year, during Volunteers Week in June 2022, we did quite a successful Instagram sort of live feed of one of our volunteers going into a clinical area, and he was photographed and sort of tracked the whole way through his shift.
Some fantastic examples of really great comms there, Eleanor. Can you give us some examples of some really great feedback you've had from a volunteer or a patient or a member of staff? Something, a story, if you like, that really makes that role come to life. What kind of feedback have you had?
Okay, so I mean, there's many examples I could give. We do get quite a lot of young volunteers who join us, because we take volunteers from age 16, so we do get quite a lot of people asking to come and support that are in sixth form or college, and they just want to get a bit of experience under their belt. They've not, you know, had this kind of insight or this exposure before to the NHS, which for some of them it's where they would like to work in the future. And some of the feedback that they tell us is it's really inspiring. So, for example, we had one young lady who we placed in the endoscopy waiting room, which is the role where patients are coming for an endoscopy procedure, they wait. So we have a volunteer that goes around, chats to them, answers any questions, finds out things if they're a bit unsure or worried. And for those that are able to have a drink, she'll take them a cup of tea. And she did say that she wasn't expecting it to be so sort of humbling as it was, and she was able to hold a patient's hand and reassure them, and she really gained a lot from that experience. It was more emotional than she thought that the volunteer role possibly would be. And for volunteers that are maybe going into university to study, to perhaps be a nurse or a midwife or a paramedic or whatever, it's those kind of softer skills, those emotional skills that we feel were very important and will prepare them for that journey. The staff feedback we get is that they're just so grateful that the volunteers really take the pressure off, because the clinical staff can't be there all the time to talk to patients and chat and hold hands, and that's why they really appreciate the volunteers for relieving that pressure on them. And also, like in winter pressures with ED, you know, we've just opened up a new ambulance receiving centre, and volunteers have been placed in there, and it's a new service. We've kind of hit the ground running with it, but to have volunteers there and be able to guide people as they arrive from one area to another, the staff have just fed back to us that that's just relieved so much pressure on them and made the job easier. When we did the Instagram live feed last year with a young volunteer called Niraj on our acute stroke unit, we did ask the patients for feedback about the volunteers, because that's important as well, and that's not something, you know, sometimes we don't ask them. And one elderly lady that was interviewed said she really appreciated it. He made her some cups of tea and just had a chat with her, and she knows that the clinical staff haven't always got time for that, so really appreciated it. It meant a lot to her, made her stay more comfortable, and she would just like to see more volunteers visible on wards like he was.
Eleanor, it's so great to hear those real life examples, and I'm sure that, you know, there will be lots of questions from people who are wondering how they could set up something similar in their own organisation. It's a really kind of far-reaching role that has an impact on all areas of your trust, so it's fantastic to hear those examples. And I just want to say thank you for joining us today. Really enjoyed the conversation and hope that our listeners have been inspired. And if it's okay, if anyone has any questions, I'd like to forward them to you, Eleanor, and you know, perhaps pick up the conversation. Thank you.
Yeah, okay.
And thank you to our audience on LinkedIn for joining us. Great to have you with us. If you would like to be in the spotlight one Monday morning, please do get in touch with us, and we'll have a chat. Thank you very much.
Thank
Bye
you,
for
Sally.
now.
Thank you.